Health insurance hasn't changed much in over 50 years, so we're excited to introduce a new type of health insurance plan called episode benefit plans for employers. Episode benefit plans reduce costs and encourage employers to take part in keeping those costs down for employees. They also lower costs and increase transparency while retaining freedom to choose any hospital or physician. In healthcare, most payments are made on a fee-for-service basis for each physician visit, and all charges related to surgery and hospital care. There's a different charge and separate payment is required for each one of those services. No one, including your physician, really understands how much this is all going to cost. The sticker shock is always the amount you owe. An innovative alternative is to have a single payment, often called a bundled payment, for all the tests, services, and treatments patients receive. In an episode of care, Medicare began using bundled payments in 2014 as a way to lower the cost of expensive episodes and to improve patient outcomes. The team behind Oxbridge Health created the nation's largest Medicare bundled payment program. In partnership with 213 hospitals and over 200 physician groups, we achieved annual savings to Medicare of over $150 million. Serving the Medicare program taught us that when you pay for healthcare at the episode level, you encourage cooperation among healthcare providers and you create certainty around what the cost will be. We've integrated these advantages into a health plan that employers can offer to their employees. Our innovative episode benefit plans achieve premium levels below HMO or PPO plans for the same benefits, and they create greater consumer engagement and predictability. Episode benefit plans are the most advanced expression of bundled payments. By organizing all costs into one simple, easy-to-understand, guaranteed price for all services and applying an allowance, your employees are able to consume healthcare and make decisions similar to many of their shopping experiences in daily life. With our plans, you don't have to sacrifice the freedom to choose your own doctors and hospitals. Just as importantly, these new plans provide a path for employees to lower their out-of-pocket costs and completely avoid the kinds of crushing costs that can wipe out a family's savings. We tell you exactly how much your benefit pays and let you see how that compares to guaranteed episode prices. The benefit coverage in episode benefit plans is similar to HMOs and PPOs, offering comprehensive coverage that includes hospital care, physician services, laboratory and prescription drugs, along with optional levels of coinsurance, deductibles, and copayments. So, it's easy to compare these plans to any other type of coverage, but when it comes to those really big expenses that can wipe out your savings, we show you what your benefit pays and compare that to the fixed bundled rates we have obtained for the entire range of healthcare treatments and services. For an episode of care, our plan uses episode allowances and fixed bundled rates for the episodes of care that represent approximately 50% of annual spending in an employer health plan. These are the big-ticket items that drive most of the variance in spending and where waste and inefficiency is well known. Whatever the duration of that episode, from 30 days to a full year, we offer fixed-price options for you to choose. Inside Oxbridge's episode benefit plan is our proprietary approach to episodes of care, Episode Advantage. Let's take a closer look. Episodes of care are defined by teams of physicians and data scientists working in each medical specialty. We use standardized clinical episode definitions that have been created by PACES, a nonprofit organization that is leading an initiative aimed at achieving greater transparency in healthcare spending. These definitions define the specific diagnoses and the services that comprise each episode of care. The Episode Advantage allowance is the amount of funding available for your episode of care. We call, we send you a text, we email you with your benefit allowance, and show you the options available to lower your cost and to work with established care groups. This allowance is generally set at the 70th percentile of observed episode costs in a specific region. So, the allowance is more than a majority of groups of healthcare providers will charge. Employees can use their allowance and their guaranteed bundled price to pay for care. We offer our best prediction based on our algorithms we maintain for all healthcare providers. Another powerful feature of Episode Advantage is that employees can compare the total episode price based on your choice of hospital or physician. These are the bundled rates Oxbridge pays for the entire episode of care. Employees have the freedom to choose any provider they like, and if they choose providers with lower prices, they can even keep some of the savings. But if they choose providers at episode price levels higher than their episode allowance, the plan design may require them to pay some or all of that additional cost. Episode benefit plans are a great fit for employers because they represent an alternative that gives employees a chance to lower their out-of-pocket costs. Our plans are designed to achieve significant healthcare cost savings while continuing to offer outstanding benefits, and they emphasize the importance of predictable costs while increasing employee engagement. We make it simple to choose high-quality and cost-effective care. These plans meaningfully lower their out-of-pocket costs. They allow freedom to choose any physician or hospital, and they come with a radical level of cost and quality transparency that is always available. So, thank you for watching this summary of episode benefit plans brought to you by Oxbridge Health.